Are you happy with your doctor? If not, why are you still going to that office? Choosing the right doctor goes way beyond determining whether they take your health insurance and that the office is conveniently located. Your doctor should be your most trusted advisor in health.
In this video, we look at the considerations about choosing the right doctor for you specifically.
Diabetes sucks.
But at Simply Diabetes, we can help you manage your diabetes cheaper and easier.
We are not medical professionals. We are people with diabetes, just like you.
Welcome.
Switching doctors can be a traumatic experience. Yet, it is sometimes unavoidable. You might move, or your doctor retires, or your health insurance changes.
Or, and that can be surprising to some people, your doctor might not be the right fit for you.
If you're unhappy, there's no reason to stick with someone you don't like.
The first thing you need to decide is what you need from your doctor. Does this sound like a stupid question? It might be obvious to you. You want a doctor that will take care of your healthcare needs. Simple, right?
But let's consider it a bit more carefully. One doctor is not the same as another. This is exactly like every other professional. Some doctors will focus on the test results. If the numbers are outside the predefined range, they prescribe more meds. If all is in the range, you are good. Others look more at the whole person.
Do you have a preference?
Let me share my experience. When I lived in Seattle, I had a doctor for a while, and I thought he was fine. I didn't really need all that much. Everything was mostly well, other than an occasional cold or sniffling or something. But I thought he was good. And then one time I started getting recurring yeast infections. I ended up going to my doctor and they did some tests, and my A1C ended up being well over 12.
I remember that.
If you know anything about diabetes, you know that that's about twice as much as it should be. So a pretty scary number. And my doctor said, well, you have diabetes, but don't worry about it, it's fine. I have a lot of patients with diabetes. So here's the prescription for the pills. This woman over here will teach you how to use a glucometer, and you might want to have a couple of chats with a nutritionist. See ya. I tried to ask some questions, and he basically said, oh, trust me, it's fine. That was the last time I saw that doctor. I don't need someone to just brush me off like that. When I have questions, I want them answered.
My experience with the doctor that I needed to change was similar to what Majana was talking about a little while ago, that all he cared about was the numbers. If the numbers weren't right, he'd write me a prescription. And so I saw him 2, 3, 4 times, and every time I walked out of there, I got a prescription for something else. Rather than trying to holistically get down or figure out a way to correct the problem without pills, all he wanted to do was write a prescription and get me out of the office. And I didn't need that. I wanted to be able to talk to somebody and come up with a plan that worked for me, and not just get pills thrown at me.
I remember we tried asking questions and he wasn't terribly willing to answer them.
No, all he cared about was, no, these are the numbers. Here's a prescription.
Yeah, it was awful.
I did stay with that same office. I tried one other person before I settled on the doctor I have now. She's been fabulous. I like her. She seems to care about me as a person. And my health, I'm in my mid-70s now. My health is still pretty good.
Yes. When I had my experience, I also stayed with the same office, but I did something that I should have done already. I called the office and asked if they had someone, a doctor, that had diabetes themselves. So that's one thing to keep in mind. If you want just the dry instruction that you follow, that's fine. For us, we don't look at our doctor this way.
A doctor should be a trusted advisor, but it's our bodies. We're the ones making the decisions. After all, our bodies are what we're talking about here.
The other important issue with diabetes is that there isn't a general agreement on what good diabetes control looks like. Surprised? So were we when we found out. With diabetes, you need to decide before you choose your doctor, or you risk running into a doctor that doesn't have the same approach as you. That doctor might be excellent for someone else, but not for you.
Since we have diabetes, we need to decide how we ourselves want to approach the disease, and then find a doctor that shares our philosophy.
It sounds a bit complicated, so let me explain. I was shocked to find out that there is no generally accepted standard of what a target A1C should be.
I thought that the American Diabetes Association recommends the A1C under 7, then everyone follows that standard.
I thought that too, but no. There are organizations and individual doctors who don't agree with this standard and don't keep their patients to it. Some doctors think your A1C should be closer to 6 or even lower, and will aggressively target that number for you. Other doctors think that if they push a number that is too aggressive, the patients will balk and not take care of themselves at all. Many of these doctors consider 7.5 or even 8 a fine number to shoot for. Now, a patient who is determined to get their A1C under 6.5 will be very frustrated with the doctor who believes that 7.5 is a good target. Similarly, a patient who already has trouble keeping their diabetes around 7 might not want the doctor who pushes them to aggressively lower their number.
It's your body. You need to decide how much you're willing to do and what risk you're willing to take. And then you can find a doctor who will help you meet your goal. For us, we decided to follow the American Diabetes Association and aim to keep our A1C under 7. The American Diabetes Association recommends this as a good target for most people.
You might choose a different target, higher or lower than us. That's okay. But be very clear on why you choose that specific number. Do you prefer tighter glucose control because complications run in your family? That's a very good reason to lower your numbers. But this tighter control comes with a lot of lifestyle changes. If all you want is for meds to do the work for you, it might not be the best approach.
Are you having difficulty meeting the tighter target, but want to control your diabetes reasonably well? That's fine too. In this case, your target will be higher, and you need a doctor that supports your decision.
Doctors are not like Legos. They are not interchangeable. One doctor is not the same as another. Not in what they know, and certainly not in how they mesh with you. Some people don't think about it this way, but all doctors are not the same. Doctors are human with their strengths and weaknesses, personal preferences, quirks, and so on. So someone can be a fantastic doctor for your friend, but completely wrong for you. That's okay. Your job is to find the right doctor for you.
We don't mean that your doctor should become your best friend. If this happens, wonderful. But if you find someone who you respect and can discuss your concerns with, but who isn't giving you the warm and fuzzies, that's fine. We each have a different doctor. Both of these doctors are right for us. Neither one was the first doctor we've had since we moved to Las Vegas.
So once you know what you want from your doctor, how did you choose the right one? Are you happy with yours? There's more to choosing your doctor than confirming that the office location is handy and that they accept your insurance.
Many people don't look beyond these two factors. Yet there's a lot more to consider. We will look at several factors, but the last one is the most important by far. So stay with us here.
Above all, if you're not happy, there's absolutely no reason to be stuck. Unless you live in a tiny place with very limited choices, you can change your doctor tomorrow.
We mentioned earlier that doctors don't agree on the target of A1C. But who decides?
There are several groups that establish guidelines. Here are some. These targets are tailored based on individual patient and the specific context of their diabetes management. As you can see, doctors, even very well-respected ones, don't always agree with one another about where the ideal A1C for someone with diabetes should be. Add to that, the healthy A1C for someone who doesn't have diabetes is typically considered below 5.7. This is the number where our bodies are functioning as designed.
So, if doctors recommended a higher number, particularly specifically for you, ask them why.
There might be a perfectly good reason to aim for a higher number. If your doctor can explain their reasoning and it sounds reasonable to you, you're done. You've found the right fit.
In the previous video, we talked about knowing your numbers. A1C, blood glucose. So, how do you find a doctor who's right for you?
Asking friends is the first step, but you shouldn't end your search there. A healthy friend who just needs yearly checkups might not know what that doctor thinks when faced with more complex situations. They can tell you the doctor is nice, but that's not a very valuable insight.
If you have a friend in the medical profession, their opinion means more.
Yes, but not everyone has such a friend. Let's get practical. Your insurance agent or company can provide the list of doctors that accept this particular insurance. Pick 3 to 5 that are conveniently located and accept new patients. If you have a preference of a male or female doctor, pick accordingly. Look up each doctor online. See their background, what they say about the care they provide. Some specialize in diabetes care, even though they are not endocrinologists. These are particularly interesting to us.
See what patients say about that doctor and that practice. Doing this kind of research should give you a good idea of what that doctor is like.
Now is a good time to find out from someone in the medical profession. When I was looking, I asked my friend who provides care for the disabled. She knows a lot of doctors and recommended 2 from my list. I looked them both up and both seemed fine. I chose the one that is closer to my home.
In my case, I liked the office, but the particular doctor didn't mesh with me, so I switched to someone else in that office.
If you don't have a medical friend, there is someone who can help. Talk to your local pharmacist. Generally, pharmacists are underappreciated as a source of information other than how to use a prescription. Don't underestimate them. They know all the doctors in the area, heard stories from patients, and formed their own opinions.
Pick a time when the pharmacy is not busy. Obviously, if there are lots of people waiting, a pharmacist won't be able to have a chat with you. But if you find a time when you're the only patient or the only customer, go for it.
Not every pharmacist will want to talk to you, but many will. Collect a couple of names, do your research online, and there you have it, the right doctor for you.
If you found this video useful, give us a like. Subscribe to our Simply Diabetes channel and hit the bell icon to let you know when a new video is available. We publish one every Tuesday.
And don't forget to tell your friends. Together, we can keep diabetes at bay.
See you next week.
Until then, keep your blood sugar in a healthy range.